Today, WKBN's Dee Crawford continues to look at efforts by the Mahoning County Mental Health and Recovery Board to address untreated trauma in people, especially our youth. Trauma is considered a major factor in street crime and violence. Here's today's in-depth segment.
As we continue our conversation in depth regarding trauma and the impact of trauma, and one of those is violence in the community. What happened that mental health decided to be proactive in its approach to address trauma and to be, I would even say, aggressive?
Well, we know there's a need in the community. I address all of Mahoning County to make sure that individuals are aware of the resources, particularly towards the minority communities, underserved populations. There are stigmas attached to mental health, and we want to reduce those stigmas. That's my job, is to help them understand that it's okay to receive help. It's okay to understand that when you need help, you know, to move toward the help that's available to you. And so the more I'm out in the community to say, this is a resource for you, this is a resource for you. Individuals approach me all the time when they see me set up. They see, oh, I need some information on mental health. I needed to know that. I wasn't aware that that was available to me. And so, like I said, the more I'm out, the more people realize, okay, I can do this. I can go out. I can get the help that I need. We're getting ready to launch a new initiative to make sure that people understand that they can move toward the help and the resources that are available through our agencies that we work with. And we just want people to know it's okay. It is okay to get help. And as more we reduce those stigmas, especially with the young people, a lot of them, you know, they may not be comfortable, you know, talking about that I have an issue. We go, when you have an issue with your arm, you know, you break an arm, you break your wrist, you break your leg, even with your heart, your lungs, anything, we go to the doctor. You know, we readily go to emergency. We readily go to get that help. But if there's something going on mentally, I don't want anybody to know.
But we're seeing an increase in our communities for the need for mental health because of so much trauma.
Right.
I'm going to continue to use that word. Our children are going to be going back to school. Mm-hmm. They're dealing with that issue again. You know, our kids are more knowledgeable today than, quote unquote, we were at their age because of the technology. Dealing with back to school, concern about safety in school. They're using the internet now as a part of this whole issue of violence with our kids. Is the mental health system looking at ways of making a stronger presence in our educational systems?
Yes, yes. We want to be available, and the more, you know, I have, you know, met with some school officials this year, and I used to work a lot with, you know, all of the schools, and, you know, so they're aware of who I am, and so, and they're now aware that who the board is, you know, so that we are, you know, are present in, you know, our schools. We are a presence in this community, and we want individuals to realize we are here. We're here, and we want to help.
I think I want to, again, address that issue with you some later date, possibly.
Yes.
But I want to thank you for joining me, and I thank you as well for joining us in our conversation as we continue to in-depth look at trauma, the impact of trauma, and the violence in our community. I'm Dee Crawford, Community Affairs Director, WKBN.